I'd like to introduce Fernanda again from QPASTT, and I'll let you continue the story.
Thank you. Good night, everyone. Let me know if you cannot hear me. My voice tends to go a bit low. So my name is Fernanda Taurasi. I'm the Community Relationships and Capacity Building Manager at QPASTT. And when Donata said she's been there for a long time, she meant that because she was there before I started. So she knows for how long I've been at QPASTT. QPASTT stands for the Queensland Program of Assistance to Survivors of Torture and Trauma. It's been established in 1995, and it's actually been in consultation with communities from refugee background that actually they said it's been good to have the medical support in the psychiatric support and being able to access medication, but we want to have a space where we can actually talk and connect with other people and not only being linked to medication. And that's what happened. I actually forgot that I have a slide. So
This one here.
This one?
Yeah.
So we are one of 8 services, one in each state and territory around Australia, and that is called the FAST, the Forum of Services to Support Survivors of Torture and Trauma. And we actually are a statewide community-based organization that work only with people from a refugee background, asylum seekers, and refugee-like experience. Our core business is counseling in torture and trauma, so we work with people who actually has been tortured or had experienced traumatic experience previous to leaving their countries of origin and arriving into Australia. But we understand that recovery doesn't happen only at the individual space. We know that recovery happens with families, and recovery happens within communities. That's why is that we have a model of, yes, counseling services for individuals, families and couples, but we also provide services for the communities. We provide group work. We provide support for other service providers to feel comfortable to work with this client group. We provide training and a number of other services to support that recovery. Just to let you know, in difference to the settlement services and maybe similarly to what GPs can do, we are very lucky that we can actually work with people for as long as they need it. And we don't only work with newly arrived people, we can work with people, if people have been here for 40 years and they've been triggered by some events in their life, we can also work with them in supporting in that recovery process at that time. Again, as I said before, we are extremely lucky that we can work with people in their individual needs. And so someone might need to access our services for a short time. It might be 5 sessions, 6 sessions. Someone might need to access our services for 5 years, and we are able to do that, which is quite special and very lucky. To give you an idea, in the past financial year, we worked with about 2,000 people around Queensland, and we work with people from 70 different countries and we had to provide 60 different languages within that. Our main office is in Wollongabba, but we also have an office in Logan and another one in Inala, and we provide services in Toowoomba, Gatton, Rockhampton, Townsville, Gold Coast, Eastwich, Goodna, and I might be forgetting one, but it's in there. In Cairns, at the moment, we don't have the presence of a counselor, but we provide group work for the community there and training for some other service providers. Oh. Click. Uh-huh. I didn't realize that I'd been into this special type of show. showing, but I mentioned this to you before, so we provide different type of counseling. We provide work for young people. We also have, and as I was telling you before, these wraparound services that will allow the recovery to happen in different spaces, like the homework club, the school holiday activities, the youth support workers at the schools. We also understand, in the same way as it's been very clearly said before, there's a need of building trust. We understand that that is a need for us too. So we know that the communities that we work with, counseling is not a cup of tea for many of them. So we need to be able to offer services that are good, important, and useful for them. So that's why we have many services that they can access the organization, get to know our staff, feel comfortable who what we are, and that might be good enough for the recovery. But also, if they want to access counseling, that might be the other step that we allow them to connect with us later on and request counselor. It happens quite commonly with the young people. So young people might come to a homework club from Monday to Wednesday if any of you is interested to volunteer. We have volunteers, tutors helping there, and we are always happy to receive new tutors and volunteering. But young people will come to a homework club to do their homework from 5 to 5 or 3:30 to 5:30, depending on the season. And they start connecting with the tutors and with QPASTT staff. And we have the very case of this young woman that was coming very regularly and asking for different type of support, until one day said to one of our counselors that was in the homework club, "Can I please have a word with you in a different space?" And then she explained to our counselor that she was having difficulties at her home. She needed to be able to talk to someone, and she felt that there was a space where she felt safe and wanted to have the possibility to talk longer with another person. So those are the different ways that we look into engaging with people. The other thing that I thought when the others were talking, and I think it's extremely important, I'm not going to go into any concepts today of trauma and recovery and all of that, because I have very short time, and hopefully we will have a session that is only about mental health and torture and trauma by the end of the year. But I think that something that is extremely important to keep in mind is that trauma is caused for people from a refugee background. Trauma in many cases, and in majority of the cases, has been caused by other human beings. And so that's what we need to keep in mind. That is why we really need to make an effort to build that relationship and that connection. So one of the questions was, how do you raise issues relating to torture and trauma, and when is it appropriate? Well, I would advise you, torture and trauma are two very strong and not very inviting words. So please don't use them when you are talking to your patients about services available for them. There are many different ways and more gentle ways to discuss how they can access our services or other services similar to ours in relation to this. So you could definitely say, certainly in Australia is really nice and very positive. However, there could be many challenges within that. There's many different things. There's many different systems that you need to learn and you need to get used to. And that sometimes can be frustrated. And people sometimes get extremely angry, get worried, get sad, and they don't know why. There are services that can help you understand that and go through that process. Or you could say things like, when you come to a new country, family's dynamic changes. And it happens, you might discuss that with your patient. You know, it happens that the children learn English quicker than the parents, and the parents feel that they are in a completely different space and they are not in control anymore. And the child is the one who is managing a lot of the knowledge that is in the house. And that can be extremely challenging and difficult to support the children through. So that can be another conversation that you can start in how to think that support. Another one is, you mentioned about nightmares or bad dreams. People sometimes, if you talk about nightmares, they might not know what we mean on having difficulties to sleep. You could say that's sometimes very common. And there's different ways that you can work around that. There are services that can help you with it. If you want, I could explain you more about it, or if not, I could refer you to some of those services that can help you understand all of these challenges from a better space. So these are ideas for you to keep in mind in how to have this difficult conversation. If you also, as Liane clearly said before, if you don't want to open up the discussion to more challenging part of it, this can be quite helpful and to the point too, and give you an understanding of what is happening with them. So just to finish, what to do to support a trusting relationship, as I said, and it's been said all along the way with everyone that spoke here tonight, the trust is essential. So relationship is the base for any work that we want to do. Relationship is what allows people to feel safe. Relationship is what allows people to feel in control. And that is where we get when we want to help people recover. And that's what we need to keep in mind all the time. So I would say be genuinely interested. People are grateful when we are genuinely interested. This is something that I want to let you know. We did a consultation with many communities because we are updating the refugee desktop guide for GPs and nurses, and we wanted to inform from the community space. And many communities had said, I'm tired of GPs asking me, how can I help you? I'm here to know how they can help me. I don't know how they can help me. So that's why, let's think in a different, and that's a very normal question that we ask people, how can I help you? Well, maybe we need to say something like, are you in pain today? Why have you come here? And the things that have been said before many and many times, ask them questions, explore. Many of the families that we work with, they don't feel comfortable. They don't bring you the information if you don't ask them. You have the power. You are the one who knows, so you should know what to ask. Explain the steps. These things have been said before. Explain the steps that you are taking to support them feel better. Help them feel in control. Tell them why you are doing the test that you are doing. Be consistent and come in October, hopefully, to the mental health session, and we can discuss this a lot longer. Thank you.
Thank you. All right. Thank you.